The following video contains general advice on using Buccal Midazolam. It does not take into account individual medical conditions or needs. This video is only to be viewed by persons who have already received instruction on the administration of Buccal Midazolam specific to their child's individual needs from a healthcare worker. Warning: watching this video in isolation will not equip you to safely administer Buccal Midazolam. Because Buccal Midazolam can cause breathing difficulties and resuscitation may be necessary following administration, all persons administering Midazolam must have already received instruction on the administration of Buccal Midazolam from a healthcare worker, undertake accredited basic life support training, and call an ambulance whenever Buccal Midazolam is administered, unless your doctor has instructed otherwise. Sydney Children's Hospitals Network does not accept any liability for any injury, loss or damage incurred by the use of or reliance on the information provided in this video. The following education video is a reenactment of a child experiencing a seizure and being administered Midazolam.
Molly.
For ease of demonstration, the child is lying still throughout the video. In a real-life scenario, Midazolam should only be given if the child is actively fitting. Midazolam should not be administered if the seizure has stopped. A detailed step-by-step guide will be provided after this reenactment.
My child is having a seizure. She's been seizing for almost 5 minutes and she has a history of prolonged seizures.
Seizures that continue for 5 minutes or longer are much more likely to require drug intervention and treatment to help terminate or stop them. The aim of giving midazolam is to stop seizures, prevent status epilepticus, and to prevent and protect the child from injury.
Our doctor has medically prescribed her midazolam and I'm about to give that prescribed dose.
An emergency plan is important. It is the responsibility of your treating doctor to determine whether emergency medication is indicated. The dose of midazolam is calculated according to your child's weight. You should review your emergency seizure medication order with your treating doctor at regular intervals to ensure the dose is current and the medication is still required.
And I'll need an ambulance to attend, please.
Midazolam can cause respiratory suppression or breathing difficulties, and resuscitation may be necessary. It is recommended you call an ambulance if you administer midazolam. This is imperative if your child develops breathing difficulties. Any personalised instructions on when to call an ambulance should be clearly outlined in your child's PENNSW emergency seizure medication order. To call an ambulance in Australia, dial 000. Provide emergency staff with the time of the seizure, the child's age and medication, and the dose of midazolam that has or will be administered. It is also recommended that caregivers undertake accredited basic life support training. This is essential if families live remotely or where access to emergency medical support is limited or involves considerable delays. Ensure your child is breathing and positioned correctly before getting the midazolam. You should always check the expiry date of the medication, preferably before it is required in an emergency. out-of-date medication may not work as effectively. Make sure you have everything you need before you get started. You should check the dose indicated on your emergency medication order. You should then double-check the name, dose, and expiry date on the medication before you give the dose. Place your child on their side and ensure they have an open airway. Do not restrain your child's limbs or place anything in their mouth. Twist the top of the plastic ampule to open. Draw up the prescribed dose into the marked syringe. Check carefully before administration. Avoid air bubbles. The solution should be clear. Avoid glass ampules which are difficult to handle in an emergency situation. Eliminate secretions from the buccal space. This means making sure there is as little saliva in the cheek area as possible. You can gently stroke the child's cheek to help remove secretions before administering the midazolam. To give, insert the syringe between the inside of the lower cheek and the teeth. Gently syringe until the prescribed amount has been given. If the ampule contains your child's exact dose, gently squeeze the ampule into the lower cheek. If some of the dose is lost, do not re-administer. Note when and how much midazolam you have given, and ensure you tell the attending ambulance officers or any other treating medical professionals that you have given midazolam and the dose, to ensure they take this into consideration if further medication is required. Following administration, your child needs to remain in the recovery position. This means lying your child on their side, usually with the top leg bent to prevent them rolling forward. Penn New South Wales has a seizure first aid poster demonstrating the recovery position. Stay with your child and observe their breathing. Check that their chest is rising and that you can feel warm air being expired. Midazolam must be stored safely out of reach of children. Midazolam is considered a scheduled drug as its use can cause respiratory suppression or breathing difficulties. Other side effects of midazolam include sedation and rarely agitation. Plastic ampules need to be stored in a cool insulated pack below 25 degrees and protected from the light. Check the medication expiry date provided by the pharmaceutical company or your pharmacist. Be aware that the expiry date of the medication will change once the packaging has been opened. Consult with your pharmacist for more information. Midazolam needs to travel where your child goes, in case of a seizure when away from home. It is very important to follow your doctor's advice on when and how to give midazolam, when to phone an ambulance, and when to take your child to hospital. Your emergency seizure plan should be regularly reviewed. Undertaking an accredited first aid course is essential.